right, good afternoon, everybody. Thank you for joining us here today. We're here to talk about the American Rescue Plan dollars, and as you know, Louisville Metro government received $388 million in funding through the American Rescue Plan, which is the COVID-19 relief measure passed by Congress and signed into law by President Biden on March the 11th. It's a critical piece of legislation. It's designed to meet the most urgent needs of communities across our nation as we continue our work to defeat COVID-19 and rebuild from its devastating impact. On June the 10th, we announced that about $30 million of the $388 million that our city is receiving would go to some immediate and urgent challenges, including health recovery needs related to the COVID virus, housing, food, and utility instability experienced by our most vulnerable residents, and to our economic recovery. I'm pleased to say that a lot of the work in those areas is already underway, including with the city's public health department to curtail the spread of the virus. But make no mistake about it, especially at the time of this dangerous Delta variant, there's still a lot of work to do. And we've got the public health department, other agencies working as well, for example, on projects to help those facing eviction or struggling to pay utility bills. So all that's moving well. Today, council leaders and I are here to announce our recommendations for the remaining funds. They'll be shared in a council resolution filed today that you'll be hearing more about in a moment. So data and public input have been essential drivers of our ARP priorities, from our Build Back Better Together process to the over 1,000 responses to an online survey from my office, a separate council survey, and the comments the public shared in the 3 hearings sponsored by the council. We all know there's a lot of needs in our city, and the $388 million in ARP funds will help us address some of them. Though, as you've heard us say, the needs in our city are quite immense. For example, we have over $2 billion just in deferred maintenance alone. But that being said, the data shows where we have potential for significant impact, and public input overwhelmingly fell into the 4 focus areas which provide the framework for the following ARP priorities. First will be homelessness and affordable housing. These are challenges faced by cities all across our country, and addressing them is certainly a priority for us. We recommend using a good amount of the ARP funding to significantly reduce the number of people experiencing homelessness. That includes transitional housing, permanent supportive housing, and other forms of affordable housing, particularly directed at Louisville's lowest income residents and those suffering from mental health and substance use disorder who have been disproportionately affected by the COVID-19 public health emergency. Second focus area is workforce development and small business support. Our city is rebounding nicely from the pandemic recession, and we know that for us to competitively reposition for a digital economy and the job openings in our community, both in the digital economy and outside of the digital economy, we have to further invest in our workforce. And to truly realize our potential as a city, we must create an economic ecosystem that builds, supports, and encourages Black and brown businesses and business owners, workers, and communities. So that's a big focus of this area, along with broadband and small business support, also essential factors in this strategy. The third area is a focus area we call Healthy Louisville, Healthy Neighborhoods. We want not just to survive this pandemic, but obviously we want to learn from it as well. So in addition to preventing further spread of COVID and mitigating its impact, we want to seize this opportunity to more quickly realizing our goal of becoming an even healthier city. That means improving access to health care and child care, including mental health, substance abuse, suicide prevention, and promoting and supporting healthier living environments in communities most critically impacted by the virus. And finally, the fourth area is public safety, which of course is tied to being a healthy city with healthy neighborhoods. This priority area will build on the work we are already doing to reduce violence and increase safety in every neighborhood. It will include recommended investments in violence prevention and intervention and new policing technology and deflection and diversion programs. Because, as we've said, some situations should involve a social service response rather than solely law enforcement, particularly when dealing with people struggling with homelessness, mental health challenges, or substance use. Many of your city government employees have risen to the occasion of serving our city with great distinction during the depths of the pandemic, so this will be another area where the ARP funds will go to. So in keeping with U.S. Treasury guidelines, we're also recommending that some of the ARP funding goes to provide premium pay to city government workers needed to maintain critical operations, including in public health, safety, and sanitation during the COVID-19 health emergency where they have worked and are working in hazardous conditions. And last, we will also recommend that some of the ARP funds be held for additional COVID mitigation and prevention if necessary. Clearly, as we're seeing with the Delta variant, this virus does not want to go away. We want it to go away, but it is not going away. So the Delta variant, we're not sure how long it will be with us, and then subsequent variants as well. So there are some important open issues also that we hope will be resolved as we finalize our plan. So we don't know everything we'd like to know right now, but we've got to move forward on what we do know. Here's some of the open issues. Kentucky, the state of the Commonwealth of Kentucky was awarded $763 million in child care support. How those funds will be allocated to Louisville and how they will be spent will ultimately impact our total recommendation. How JCPS will use part of its ARP allocation around community safety, out-of-school time activity, and how that will complement the city's priorities is something we need to have further understanding of. Any outstanding amendments in the U.S. Congress that may be relevant to the ARP funds, including the current Senator Cornyn and Padilla amendment regarding potential uses of the ARP funds for infrastructure, may impact the final recommendation. And then, of course, final U.S. Treasury guidance on questions raised during the open comment period, which closed July 16th. They have not all been answered quite yet. You're going to be hearing from the Council's Budget Chair, Bill Hollander, and Vice Chair Kevin Kramer in a moment. The focus area and open issues I've just outlined reflect discussions between us, my office, and the Council, in our agreement that while our city has many needs, the areas that I've just mentioned reflect the most effective, inclusive, and equitable way to allocate our ARP funds given requirements set forth by the federal government. And again, those requirements state that funding must go towards initiatives or programs that respond to the impacts of COVID-19, including both public health and the economic consequences. So what's next? Now that we've identified these 4 areas of focus, the next step is for Metro Council to meet, review, and approve them or amend them as our priority areas. Once they've voted, my office and council budget leaders will work with community partners on various proposals through an open public request for proposals process, which will result in the development of specific appropriations within each of the focus areas. Then, after thorough study by my office in consultation with the council, specific projects will be submitted to the full council for approval. As the council resolution to be filed today says, the expectation is that we will propose, my office will propose, and then Metro Council will approve projects in each of the focus areas that promote equity and make a sustainable, significant community impact rather than smaller projects that, while valuable, don't have the potential to make lasting change in the community. So this is a process we estimate will take us well into the latter part of this year to complete. For individuals or agencies that want to communicate with the ARP team prior to the formal RFP process, you can email us at accelerator@louisvilleky.gov. And you can keep up with our art process at louisvilleky.gov Accelerator. So now I'd like to turn this over to the council. I want to recognize Council President James for being with us as well. Councilman Ja'Cory Arthur, keeping a somewhat low profile over to my right. And then you'll be hearing from Councilman Hollander and Councilman Kramer. So now for our budget chair, Councilman Hollander.
Thank you very much. We have serious needs in Louisville, many of which have become more pronounced in the pandemic. The local fiscal recovery funds give us a remarkable opportunity to build back better and to make lasting change. I want to thank the many people who responded to our surveys and showed up at public hearings to talk about the community's needs and appropriate uses of ARP funds. We've heard from literally thousands of Louisvillians who care about our city. Like us, they want to see us make lasting change with this opportunity. From the days the American Rescue Plan was passed and the interim final guidance was released, our goal has been to use local fiscal recovery funds in sustainable ways to make long-lasting change. And I believe the community that we heard from in these public surveys and in our public hearings, the council and the mayor are united in that goal. We prepared the resolution today. There are copies here for members of the press. I think it's online now at the Metro Council webpage, the clerk webpage. There are 4 co-sponsors of that: President James, Vice Chair Kramer of the Budget Committee, Councilman Arthur, and myself. And as the mayor said, we have set out 6 areas, really, 4 primary areas: homelessness and affordable housing, workforce development, healthy Louisville, healthy neighborhoods, public safety, and then premium pay, public health contingencies, and eligible infrastructure, making the comment that in the event that the federal government does not allocate additional spending for infrastructure, eligible infrastructure projects could be considered. We hope that there will be a federal infrastructure bill, and of course that's being debated right now in Washington. Let me make a couple of comments about specific areas, some comments that I've heard from council members. I was asked, for example, what about potential infrastructure in parks, in qualified census tracts, low-income census tracts that are covered by the guidance in a very broad way. I think potentially those are covered by our Healthy Louisville, Healthy Neighborhoods section, which talks about the promotion of healthier living environments in disproportionately impacted communities. Premium pay has been discussed, and I hope at least, that we will be moving quickly on premium pay. There are very strict guidelines as to who is eligible for premium pay, and we are looking right now at who is eligible among the Louisville Metro workforce for premium pay. We'll know more about specific uses and how many dollars should be directed to each priority area when we have reviewed and evaluated proposals, as the mayor said. The establishment of priority areas this month will allow us to begin formally seeking out and evaluating projects, which is the next step in putting these remarkable dollars to work. We need organizations that are well-versed in each of these priority areas to work together and make concrete proposals, and we hope that we'll begin receiving them soon. We have a lot of work to do, but this is an important first step. Councilman Kramer.
Thank you for being here, and thanks for the opportunity to speak. I don't have a whole lot to add to what the mayor and what Councilman Hollander have offered so far. I would just suggest / point out that this is the first step in getting the Metro Council to have a voice. The only way that we as a council have a voice is if we actually take a vote on something. Otherwise, it's any one of us standing up and saying, this is what we think is true. It's important to me that we recognize and understand that there are grants that are coming through the federal government for all kinds of programs, and we want to make sure that as much as possible, we capture those grants before we start digging into these ARP funds. Again, that's a part of the resolution that Councilman Hollander mentioned. I do very much appreciate all of the public input in trying to figure out where we go with these funds. I would say that there are things that need to be taken care of that might not be so sexy, that didn't get quite the same level of attention from the public. And I assure you that when we get back on our side of the street and 11 members of the Budget Committee are sitting in a room and we're talking about what needs to be done, we're going to hear things that may not have shown up so far in some of that discussion. And that will weigh in and that will have an impact on how this all unfolds. But if we don't take this step today, it puts off further and further and further when we can actually start taking action. So really looking forward to getting it over to the council side of the street. I'm really happy that we've narrowed and defined more clearly what the priorities are, and anxious to hear from my colleagues if they believe we might have overlooked priorities or what they think we may need to do next. So again, thank you and look forward to the process.
Thank you, Councilman. So again, I want to say I appreciate the whole work of the council, President James and others. We've been having great collaboration back and forth between my office and the council and the public input as well. So it's going to be really interesting to see how all this ends up in projects that are going to really transform our city. Also, I want to thank Margaret Handmaker and Keith Talley. I know Keith is here. Margaret's out of town today. They've done an enormous amount of work organizing all of the ARP information, the processes, pulling different people together. There's obviously a lot going on with this. We've never had an opportunity like this in the history of our city or in the history of our country, at least in the past century or so. So it is a very large undertaking. One of the absolute essentials of this whole project is making sure that every dollar that is invested is accounted for in compliance with U.S. Treasury guidelines, so there can be no question that this money is being spent efficiently and responsibly and legally. We've worked hard to include the voice of our community. Of course, this started off with our Build Back Better Together process last year, as well as a plan we introduced late last year on advancing racial equity in our city. And we had a wonderful community plan called A Path Forward that was assembled primarily by the black leadership of Louisville that's also helped to inform our planning to this point as well. And as we continue to move through the process, we're going to continue to share information with the public, ensuring the transparency about what is really a tremendous opportunity to build the city that you want and that you certainly deserve. I've said it before, but it's worth saying again. With this $388 million, we have the opportunity to take ideas that were once reserved for someday and turn them into reality now. And we just haven't had the opportunity to do that, certainly in the length of my administration, for many terms before that. So I just want to say thank you to everybody who's taking part in this, and we look forward to a lot more further collaboration. With that, we're happy to take any questions.
Do I understand correctly that you've laid out these categories?
Hey, Mark.
Of course. Do I understand correctly that you've laid out these categories, but it'll be up to the different groups out there in Louisville to come up with the more specific ideas of how to meet the goals within those categories? And if I do understand that correctly, what was kind of the thinking of leaving it up to the city's groups to kind of come up with these specific ideas of how to meet the goals of the various categories?
Right, so we've identified the four basic broad areas that we've talked about, and then we have the auxiliary areas, if you wanted to call them, on premium pay and COVID extension, et cetera. But in some of these areas, we're going to know what it is we need to do. Let's say, for instance, it's a police technology solution. Okay, so we'll put out a request for proposal on that, asking for a very specific response to a very specific idea. Let's go then over to homeless services. We as a city are not going to be able to provide those services. We know that we need, let's say, a safe space outdoors, and we have a concept toward that. But we're going to need to hear from the service providers in the community on how they would respond to being a recipient of the funds then to conduct those services. So it's going to be kind of a hybrid approach with these projects, depending on what it is we know specifically needs to be done versus getting broader input from the community. And at that point, I mean, that's where the collaboration will be going back and forth between council in our office. There's going to be a very fluid, ongoing discussion between us so that we can say, okay, this looks like the best way to spend funds in these particular areas.
And just to follow up to that, is there a list of specific ideas like the police tech and the safe space outdoors?
There's an emerging list of those that we'll be communicating in different ways, and then looking for the public's input on other areas as well. And you've seen some of those, Mark, in like the Build Back Better Together meetings and such. Councilman, do you want to add anything?
I would just say in the homelessness and affordable housing area, the resolution doesn't just say that we want to focus on houselessness. It says that we're talking about transitional housing and large-scale permanent supportive housing. So we, as the mayor has said, Louisville Metro will not be running permanent supportive housing. We need the partners to come to the table with good ideas, and we need them to work together, because this is going to be people who know how to build and run affordable housing. It's going to be people who know how to provide mental health services, people who know how to provide addiction services. We need all of those people to come to the table and begin to really submit some very concrete proposals for meeting the goals that are set out in the resolution.
Now, I'll just add one last thing to that we're hoping then that these proposal areas will stimulate some leveraged funding from philanthropies in the community, from corporations that might have a specific interest in the area as well, from folks that might see ways to leverage the funding that we put forward through tax credits or other issues, let's say in the area of housing, so that we can expand the impact of this $388 million even more.
Mayor, is there any update on the CBA with FOP, and will these funds, specifically public safety funds, possibly change that or go into that contract negotiation?
I can just say we're making really good progress with those negotiations. They're ongoing, and we had some just this past week, so we're optimistic that we're getting to a point that's going to work well for everybody, but to comment on that any further right now would not be appropriate.
Would these funds go into discussions?
We think we're getting to a better place, and we think they have the financial capability, with or without the ARP funds, to do what we need to do.
This is likely a better question for Councilman Hollander, but you all mentioned that, you're not sort of setting aside specific amounts for any of these priority areas just yet. Or is there one or two that you anticipate collecting most of the money just based on the results from the ARP support sessions?
I don't think we're prepared to say that at this point, and I think the reason is that we don't know what some of these projects will cost. And I'd give you the same comment that I talked to Mark about in terms of the large-scale permanent supportive housing. I think we want to do something big. We have one council member who keeps saying bold, and I agree with her. But I don't know what that's going to cost. And I think when we know what that's going to cost, and that's something that the council wants to do, we'll know then what part of the ARP money needs to go to that. But I'm confident, and again, I don't want to say in any of these categories, and I don't think the council is at a point where we want to say in each of these categories what dollars will be spent. But, we are talking about a large amount of money here, and I am confident that we will be spending more in the homelessness and affordable housing area than we have ever spent in this community, because we have resources that we have never had before.
If I may add to that, there's another angle of this that needs to be considered as well, and that is there are projects that we know need to be taken care of, right? When you get back into broadband and some of the infrastructure discussion, the current ARP funding allows us to do some basic infrastructure. But the thought is we're not sure how much of this ARP money we want to use to do those kinds of infrastructure if there's more coming. And further, as has been said by both the mayor and Councilman Hollander, the state of Kentucky has gotten a chunk of change from the process, and we still don't know how they're planning on distributing that. And so while we have a growing sense of where the need is, we really need to identify not only how much of it we think we can tackle, but we also want to establish how much we think we can get taken care of in other ways. And so again, I just think that's a really difficult question to answer with any specificity at this point.
All right, anything else? Okay, well, thank you all for coming out. Though again, we're going to be communicating a lot on this over the coming months, so more to come. Thank you.